My name's Mickey Horissian. I'm a general dermatology in Danville, Pennsylvania. I work at a academic medical system called Geisinger Medical Center. I see a range of kids to adults and everything in between. I run our Hidradenitis Suppurativa clinic here, and I've been working here about a year. Uh, and I do a combination of both medical and surgical dermatology. So it started during my residency training. One of my mentors, Dr. Jocelyn Kirby, is a pioneer in the field, and she just got me really excited for it. And I really saw the need for it after seeing a lot of the patients in our clinic. And I fell in love with the patient population, and as difficult of a disease as it can be, it fits my clinical interest too of treating things both medically and surgically, and really being a champion for people who may not have had that champion their entire life. So I think the first big challenge that we have here is getting the right diagnosis. So for years, people go undiagnosed or misdiagnosed or blamed for their disease when really it's a chronic inflammatory disease. So step one is usually diagnosing and correctly diagnosing early. And then step two is seeing somebody who actually knows what they're talking about and specializes in HS, because not all dermatologists are equal. Some people don't like treating HS, and some people love treating HS, like me. So I think those are the two biggest things. And then even after you get the correct diagnosis and you end up in the right place with the right person, I think the lack of options can be daunting. So at least in the US, we only have two FDA approved therapies for HS, and obviously a lot in clinical trials. But a lot of what we use is off label. And so getting the right medication approved or the right combination of medications for a patient isn't always an easy feat. And then, you know, going off of that too, then people that need surgery, finding the right person that will do the surgery and understands the disease. I end up doing a lot of the surgeries myself, but that's not always the case for a lot of dermatologists. So I think finding the right person to treat both medically and surgically can be very helpful. And then these are chronic inflammatory wounds too. So having a good wound team or somebody knowledge about wound care and uh, knowing how to take care of these wounds can be helpful. So the true prevalence is depends on which study you look at, but it's probably between 1% and 2% of the population that have this, and I really think it's a under talked about disease, and it's hidden. So it's not like people walking around with psoriasis on their elbows. Most of the time, it's in the armpits and groin. So even when people have it, they're not showing the world that they have it. And the person right beside you might also have it, but you guys aren't bringing up a conversation about boils in your armpits. So it's very common. I have personally, I have family members with HS, and I didn't know it until I told them I was an HS expert. So. I think HS can be extremely damaging to someone's livelihood and definitely painful. I think pain is by far the most common symptom that I see from patients, but also the itching and the drainage that comes with that, and the social ramifications of, can I go to the gym? Can I go to this place? Or am I going to have a flare? The unpredictable nature, I think, is one of the parts about it that is just so relentless. And every single person's HS is completely different. Somebody's one bump may be completely detrimental to them functioning normally, and it just because you only have one bump doesn't mean it's not, severe. So I definitely agree that it takes years to get diagnosed on average, and I think that's a downside for right now, because the thought is if we can catch HS early, maybe we can intervene and prevent it from becoming more severe. Whereas when we see somebody with stage three that's had it for 15 years, we have a little bit less options to play with. So I think globally, it's important for patients to be aware of this disease because they can bring it up to their providers. But I also think that primary care doctors, obstetrics and gynecology, emergency medicine physicians, all these teams need to be very vigilant about this disease so that if they can diagnose it early, because a lot of these people are going to non-dermatologists first for many years, and then plugging them in with somebody who is a dermatologist that specializes in this can really help. Personally, what I've done in our area is I went and talked to all the family medicine offices in the area and brought them kind of up to speed on what HS is, what it isn't, and just made them aware about the clinic. And I have got an outpouring uh, of referrals from that. But then I also have some information on the website. And so patients are, I think, much more knowledgeable now than they were maybe 10 years ago. And with the internet, you can kind of figure things out. So a lot of people are just finding me via the internet. So I think having good resources online for patients to access and direct their own health is helpful too. So I think they're even though they're wounds, they're not like a typical wound for a lot of reasons. For instance, a leg ulcer due to vein problems will usually have a reason why they have this, a set goal and treatment, and if we fix the underlying problem and treat the ulcer, it's going to go away for good. Whereas HS is a different beast of wounds. These are chronic wounds in young patients, usually that are coming and going in different areas. They're on areas that are not very easily bandaged. Um, Finding the right thing to not irritate the skin is very difficult because these are things that they're going to have for years and years and years. And so just taping an area for several weeks on end or several years on end is quite irritating to the skin. I think that's very individualized and also depends on kind of the lesion. Is it a nodule, an abscess, a tunnel? But and how many of them are there? But I think first and foremost is treating medically. So getting somebody's condition under control medically to try to limit the amount of inflammation that's there and the number of new bumps that are showing up is usually my starting point. And then for persistent bumps or tunnels that are present, I usually will discuss surgical interventions because those can sometimes be curative to those chronic tunnels that have been there for a long time. But then from a day-to-day standpoint, I think that there's a variety of different things that people do for their wounds. People are using toilet paper or paper towels or things that may not be very comfortable. So I usually try to see what works for the patient. But I generally recommend HidraWear to almost every single patient with HS because I think it's a good way for them to have a non-traumatic drainage catchment system that moves with them. Some lower budget options that I've recommended for patients sometimes is to use a maxi pad for a similar reason, so they can stick to the I should say a feminine hygiene pad because it can stick to the underside of the t-shirt and catch some of the drainage too. So I generally recommend HidraWear for almost every patient if they're interested. I think it's an absolutely wonderful product because it kind of helps tackle many of the problems that we have with HS wounds. So patients generally have chronic draining wounds that need something to absorb all that chronic drainage and something to be there for a long period of time. And so having some type of super absorbent pad is really helpful in catching that drainage and the odor that comes with the drainage. But the biggest issue most people have is how do I attach a super absorbent pad to my armpit or groin when I'm trying to move around and live my life? And I think HidraWear solves that issue too because it avoids the use of tape directly on the skin. It holds the absorbent pad directly against the affected area. So I've had really good success with it. All the comments I've gotten from patients with HidraWear are that it's really, really helpful. So I think that they really like it. It's finally a solution to a problem they've been trying to figure out on their own for years and years and years. And there's really no other medical product like it on the market. A lot of it is them kind of making makeshift things for years and years, and finally having a product designed for this disease is very individualistic and very good for the patient. So I think there's several. I think one of the benefits of HidraWear is that patients aren't getting a secondary tape irritation or tears in their skin, which are commonly reported with any of the tapes, even the paper tapes that we use that are supposed to be much more gentle for people's skin. So I think that secondary irritation and chronic irritation that they get from the adhesives is a real big benefit. I think another benefit, though, is the absorptive system. So a lot of times people are self-conscious or having drainage on their clothing, or not going out because they're worried that they're going to drain on something. And so having something that can absorb all of that drainage is really, really helpful in both improving the amount of drainage that there is, limiting the amount of drainage on their clothes, limiting the odor that comes with some types of drainage. And I think overall it's just a win-win-win. Yes, I definitely think that HidraWear helps limit the pain with dressing changes, because any type of adhesive, no matter how gentle it is, after repeated use is going to irritate and hurt. And so I think having a non-traumatic dressing change for a chronic wound is absolutely critical. I think it's also really helpful not just for the directly to HS wounds, but the post-operative HS wounds for the same reason. So after I do surgery, it can be really helpful to have a non-traumatic dressing. Typically, those wounds are going to be healing in secondarily, just filling in over a period of 6 to 12 weeks, depending on how big of an area we treat. And so that's a daily dressing change for several weeks or months, and having a non-traumatic option is definitely life-changing. I think ultimately, HS has such a profound impact on people's quality of life, for a variety of reasons. And so anything we can do to improve patients' quality of life is important. And if we just look at things medically or we just look at things surgically, I think we're missing the ball game. And so I think with every HS patient, I kind of break it down into what am I doing for you medically? Do you need anything surgically? And what am I doing to take care of your wounds? And I think that a lot of times that's a commonly forgotten part of it. So people focus on what medicine they're going to prescribe, but really that's only part of the problem. And so you need to kind of hit all three parts in order to really maximize people's quality of life. Most of our insurers in this area do cover HidraWear. I order it through a third party that then refers it over to one of the two companies that carries HidraWear in the US, and that's either Rotec or Prism. Um, and generally, most people's insurers do cover HidraWear. So after a couple weeks after I order it, they receive it in the mail. They have a 90-day supply of the absorptive pads, and then we just renew the prescription kind of on an as-needed basis. Now, it's not the simplest process, so I wish things were simpler with wound care in the US, but it's quite complicated, particularly because this isn't a standard wound and standard dressing. And so kind of there are some hurdles that me and my team have had to get through, but we've made it through those. And so now we have a system of how exactly we get this to our patients. There are some insurers that don't cover wound care supplies at all, let alone HidraWear. And unfortunately for those patients, they have to pay out of pocket for it. And so they usually order it through the website, the HidraWear website, and get it that way. So one benefit of being a newer dermatologist is that as far as I have treated HS, I've always known about HidraWear. So I've been using it for the last 4 years of my practice. So that's been just good timing on my end. But before that, or before patients see me, a lot of times they're making some type of makeshift dressing or no dressing at all. So some people have tried making dressings out of tape and bandages and toilet paper, and it's just too irritating, so they choose to not do any dressings at all. I have one patient in particular who just doesn't go anywhere because he's worried that he's going to drain and leak all over a chair at a restaurant. So I think people have kind of done the best they could with what they have. And generally that ends up being things that are available in the home, like towels or extra shirts, or just changing their shirts more often, or rolling up toilet paper and trying to get it to stay in place. So that's what I've seen most of all. I have yet to see a patient that thought to use a feminine hygiene product in the area, but I do propose that for some people if HidraWear is not an option, or just as a temporary dressing until we get the HidraWear approved, to use a feminine hygiene product because it sticks to the shirt and it's not adhesive directly to the patient. But yeah, generally, I think even if I had prescribed any wound care supplies or anything, it wouldn't work well because you'd have to figure out a way to tape it to the body, and it's usually the tape that's the most irritating for patients. There are people that are out there that specialize in HS that really care and are passionate about not only the disease but the patients, with the disease and helping you. And you just have to find the right person. So don't give up on the medical community. We're behind in HS where we are with psoriasis. Now with psoriasis, there's I don't know how many, but there's countless medicines to use, and everybody's very knowledgeable about psoriasis. And 20 years ago, that wasn't the case for psoriasis. So we're kind of at that place now with HS, in that we're understanding it better, knowing what causes it better, studying it more, having all these different medicines in clinical trials, having all these different surgical techniques for HS that we didn't do many years ago. So I think the medical field is advancing, particularly in HS, and there's a growing body of people that are interested in this, interested in learning more, and interested in caring for people with HS.